So a patient walks into your clinic with diabetes, hypertension, and back pain. You do a thorough evaluation, take a good history, review his medications, perform a physical exam, review his labs, imaging studies, come up with your diagnoses, prescribe medications, order lab tests and imaging studies, and also provide the patient with an individualized treatment plan and follow-up care. But the front desk person said that you were a nurse. The MA told the patient, "You'll see the mid-level, but you know who you are, and introduce yourself as, 'My name is fill in the blank, and I am the nurse practitioner.'" This happens almost every day, but it is crucial that we be addressed by our role. This distinction makes it possible to gain our patients' and colleagues' trust and be allowed to practice to the full extent of our experience, our education, and license. So, what is a nurse practitioner? Why are NPs important? And should nurse practitioners be called mid-levels? Hello everyone, it's nurse practitioner Jessica from NP Insiders. If you want to expand your medical knowledge and fast-track your career growth and practice, you've come to the right place. So, let's jump into it. First things first, happy Nurse Practitioner Week to the more than 325,000 licensed NPs in the United States. The theme of this year's NPs Week is NPs going the extra mile. Each day, we continue to increase healthcare access to millions of patients. So, let's celebrate. This is our week. Amid the worldwide COVID-19 pandemic, nurse practitioners have stepped up to the plate. They have been on the front lines, ordering tests, diagnosing, and treating patients with COVID-19 in the outpatient setting, the inpatient settings. In addition, we continue to educate our patients, helping them to prevent the spread of this deadly virus. Thank you, each and every one of you. I am very happy to be called a nurse practitioner just like you. Okay, so let's see at some of the quick facts of NPs. 88.9% of nurse practitioners are certified in primary care, and 70% are actively delivering primary care services to all of our patients. And 78.7% are seeing our Medicaid patients. 96% prescribe medications and write almost 21 prescriptions per day. Nurse practitioners take care of more than 1 billion patient visits each year. Most NPs see 3 or more patients per hour. These are hardworking practitioners deserving all of the praise that you can give them this week and every week. Okay, so what is a nurse practitioner? Nurse practitioners are healthcare providers trained to diagnose diseases, evaluate patients, order diagnostic tests, prescribe medications, and create individualized treatment plans for chronic and urgent conditions. As nurse practitioners, we use our expertise to help patients prevent diseases and better manage the disease that they already have. We take care of millions of patients. Many of these patients would not have access to primary care services if it weren't for nurse practitioners. So why are nurse practitioners important? Well, number one, almost 80 million Americans lack access to primary health care. That is one of the biggest gaps that nurse practitioners fill in. We are increasing access to care and alleviating the patient demand load. Every single day, NPs continue saving lives and improving the health of our family and friends nationwide. To me, the second reason why nurse practitioners are important is because many NPs are putting the health of their patients ahead of their own and truly going the extra mile in serving their patients. You're all so exceptional. There is a lack of supply of primary care providers, and a lot of nurse practitioners are filling in that gap. Our population also is growing, and the demand will continue to increase year by year. But unfortunately, the primary care practitioner supply does not meet the demand. And this has created a gap in the need in patient care that our role as nurse practitioners has managed to alleviate. Even though most NPs do work in primary care, many others work as part of an interdisciplinary team in specialty care settings. And these roles will only continue to grow. They actually have grown tremendously so far to meet that patient demand. So in a way, we have helped to fill in the gaps and increase that access to patient care. Another key factor to know is that our NP care has demonstrated our ability to take care of primary care conditions. This is something that we must guard and continue to get better at. That is why I keep educating and sharing evidence-based practice guidelines and ways to manage patients appropriately. Something that comes up all the time is if nurse practitioners should be called mid-levels. I know that many times I've been called a mid-level, but is that really the correct terminology when addressing a nurse practitioner? Well, I want to take a minute and talk about this because I think it's very important. That word mid-level is inaccurate and misleading, as if somehow nurse practitioners are midway in their practice or provide midway care. Nurse practitioners should know what they can and cannot do and should be self-aware of that. I am a big advocate for continuing education, and the COVID-19 pandemic has demonstrated that medical practice for everyone in healthcare does not end graduation day. On the contrary, it is ongoing and ever-changing. We must all keep up to date every day and consult each other when we have gaps in knowledge. I am not afraid to ask questions when I am confronted with a diagnosis that is foreign to me or that I am not used to treating on a daily basis. Admitting that you don't know something is human and is actually the right thing to do. The AANP, or American Association for Nurse Practitioners, opposes using terms like mid-level or extender when referring to nurse practitioners. As a matter of fact, in 2010, the Institute of Medicine, the IOM, made a key recommendation and stated that nurse practitioners should be full partners with physicians and other healthcare professionals. All healthcare practitioners should work diligently to apply this recommendation. Another issue with using these terms is that it creates confusion and implies that nurse practitioners lack quality of care or they are just able to provide midway care. That's not the case. We know that. These terms are outdated and decrease public trust and understanding of what we do. Better terms include primary care providers, healthcare professionals, advanced practice providers, clinicians, or prescribers. As healthcare providers, physicians, nurse practitioners, PAs, we all have unique roles and also have overlapping roles. We all do a lot of the same things. We evaluate patients, create diagnoses, plans of care, we prescribe medications, treat diseases, chronic conditions, urgent conditions. But even though we are unique and also different in many ways, we all work together and actually support each other, which is what we should all do. We work as a team because the real goal we all must have is providing the best care possible to those that need it most. The reason for our jobs, our patients. I am thankful for the opportunity to serve patients in this role. It is an honor to work with physicians, to work with other colleagues, NPs, PAs, and every other healthcare provider in the field. Together, we continue to address the nation's healthcare needs and provide the best possible care, despite all these challenges that we have been enduring. So, don't forget to subscribe and visit npinsiders.com for more.